to look into a very important topic and most interesting topic like stretching. So Mr. Bharat, final year student, is going to demonstrate about lower limb stretching to us. So we look upon it.
Hello everyone. So in this video we are going to see about stretching for lower limb. So what are the muscles we are covering for this stretching of quadriceps, adductors, abductors, hamstring, calf and tibialis area. So those muscles are going to stretch, and first of all we are going to stretch a hip extensor which is in gluteus. First we want to keep a therapist position in walk standing, and the patient should be in supine lying, and we want to flex the knee, and we want to stretch knee towards the patient if it's stretched. So this is a stretching for gluteus maximus. So next we are going to next we are going to see about stretching on adductor muscle. So we want to keep the patient in crook lying position. So ask the patient to lie on crook lying, and we want to keep the both leg on as parallel, and we want to stretch the legs as separately, and we want to give a minimal pressure at the opposite side. So the adductors will get stretched.
So how many seconds? So how many seconds do we hold this position?
For this, generally we will hold for 5 to 8 seconds, 3 repetitions.
So 5 to 8 seconds.
5 to 8 seconds.
With 3 repetitions. Okay.
So next we are going to see a stretching for piriformis muscle. So we want to flex the opposite for stretching and left side of piriformis. So we want to flex the right side leg, and ask the patient to keep the leg take the see about stretching for piriformis muscle. So in order to stretching in right side piriformis, we want to work on the left side leg. Ask the patient to flex the leg and cross the leg on the right side, and again ask the patient to flex the leg and stretch towards the patient's body. So again we want to hold for 5 to 8 seconds for 3 sets. Next we are going to see about stretching for calf. So for this we want to hold the patient's heel on our palm and place the patient's So next we are going to see about stretching for calf muscle. So for this we want to hold the patient's heel on our palm and place the patient's great toe on our forearm, and we want to give a minimal pressure towards the body. The foot should be go for dorsiflexion. So you want to hold the heel on our palm and place the great toe on our forearm, and we want to give a minimal intensity of stretching. The patient will feel a stretch on the cuff. We are going to see a stretching for tibialis anterior muscle. So for this, we'll hold a patient's leg on our heel on our palm and hold on our foot. And so next we are going to see about stretching for tibialis anterior muscle. For this, we want to hold the patient's heel on our palm, and another hand should be hold on a foot. For this, we want to give an inversion and plantar flexion. The patient will feel a stretch on the tibialis anterior on the lateral aspect of the tibia. So we want to give an inversion and plantar flexion. So next we are going to see a stretching for hamstring muscle. So for this, we want to ask the patient to do a knee flexion. Yes, do a knee flexion, and we want to keep a hip at 90 degree and knee at 90 degree. Then we want to give do an extension for the leg. The patient will feel a hamstring stretch. Yes. So this is also for 5 to 8 seconds, 3 repetitions as stated. So next we are going to stretch for quadriceps muscle. Ask the patient to lie on side lying, and we want to flex the knee and hold the patient's knee on our hand, and place the patient's leg on our forearm, and hold the hip, stabilize the hip on our left hand, and we want to give a mild stretch. This is one technique, and flex the patient's knee and hold it on our hip and extend the hip. So this is another technique of bicep stretching. So these are the stretches we see today. So in next video we see further stretches. Thank you.